For more anatomy-related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
Today we will discuss about left atrium and also left ventricle. So if you have an idea regarding right atrium and the right ventricle, it will be easier for you to understand more about left atrium and also left ventricle. That is, there are so many common features similar in both. So now we will first discuss about the left atrium. So left atrium, it is the left upper chamber of the heart which is situated posteriorly, and it forms 2/3 of the base as well as major part of the upper border, and it receives blood from pulmonary veins. That is, the oxygenated blood reaches the heart through the pulmonary veins and it is pumped to the left ventricle through the atrioventricular orifice, which is guarded by the mitral valve or the tricuspid valve. So now we will discuss about the features. So the posterior wall of the left atrium, it forms the anterior wall of the oblique sinus. So if you want to know what is oblique sinus, please check into the video where I describe about the pericardium. So the posterior wall of the left atrium, it forms the anterior wall of the oblique sinus, and the anterior wall of the left atrium, it is formed by the interatrial septum that separates the two atrium, that is the right and left atrium. So the pulmonary veins, the two pulmonary veins on each side, it opens on the posterior wall, and oxygenated blood, it reaches the left atrium through the pulmonary veins and it reaches the left ventricle through the atrioventricular orifice, which is guarded by the mitral valve or the bicuspid valve. So the left atrium, most of the surface, it is smooth, and musculi pectinate, it is only present in the auricle. So in auricle, the musculi pectinate, it forms a network, reticular network. And the tributaries of the left atrium are the four pulmonary veins and also some vena cordis minimis. And in the septal wall of the left atrium, you can see the fossa lunata corresponding to the fossa vallis, which is present in the septal wall of the right atrium. So next is the left ventricle. It receives oxygenated blood from the left atrium through the atrioventricular orifice, which is guarded by the mitral valve, and it forms a part of the sternocostal surface and 2/3 of the diaphragmatic surface. And now we will discuss the external features. That is, it has got three surfaces, that is the anterior, inferior and also left surface. In this figure you cannot see all those surfaces. So next is the interior. So interior, it has got a lower rough part and also an upper smooth part. So lower rough part, it is due to the presence of the trabeculae carni, and this lower rough part, it is formed from the primitive ventricle of the heart tube. So in the previous class I have already drawn the picture of the heart tube. So if you want to know what heart tube is, just check into that video. And the upper smooth part, which gives rise to the ascending aorta, and it is formed from the mid portion of the bulbous cordis of the primitive heart tube. And the two orifices, they are the left atrioventricular orifice, which is guarded by the mitral valve, and also the aortic orifice, which is guarded by the aortic valve. And there are two well-developed papillary muscles, that is the anterior and also the posterior papillary muscles. So the anterior papillary muscle, it is attached to the wall of the cusp by means of chordae tendineae, and the posterior papillary muscle, it is also attached to the cusp by means of chordae tendineae. And the cavity of ventricle, it is circular in transverse section. So when heart is cut, in the transverse section, the cavity of the ventricle, it appears to be circular. And the wall of the left ventricle, it is 3 times thicker to the right ventricle. So, this is the end of today's video.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.